All right. Hello, everybody, and welcome to Crashing the Biofilm Party. Today, we are going to talk about understanding the path to safe dental unit water lines. A little word from our sponsor. I am sponsored by ProEdge Dental Water Labs. They are a dental water lab company. They have products and they do testing as well. So just full disclosure there. A smidgen bit about me. I am a dental hygienist, but I started out as a dental assistant. I've been in the dental industry since the 1900s. I mean, an entire century ago. I've been around. But I live in Norfolk, Virginia, which is near Virginia Beach. So I went to the Old Dominion University School of Dental Hygiene. Um, so I've been doing this for a minute. But guys, I got to tell you, I didn't know anything about water and waterline testing until I had been a hygienist for about 25 years, which is crazy town, right? So I've been doing this, I've been seeing patients, I've been squirting water and knew nothing about testing and biofilm. And in fact, the only thing that I remembered was back when I was back in hygiene school, I had an instructor tell us that every morning we needed to run the lines in our power scalers because one time a spider crawled out of her power scaler. So I thought the whole reason that we flushed lines was because of spiders. I don't think biofilm had been invented when I went to school, but now I know that I want to make sure the water that I use for my patients, this is a picture of my daughter, like that I put in my daughter's mouth is safe for her and safe for me as well. So we're going to talk a little bit about this today. But I want to tell you guys, I am still learning because this is a failed waterline test that you see here. I don't know if it's big enough that you can see it, but there's lots of red dots on it. And biofilm continues to win the war. And so I continue to learn about how to fight biofilm. So today we are going to be looking at the lines in our operatory. And this picture is beautiful. It's like nice, clean lines, and they're all straight and they're not tangled and everything's pretty and white. But in actuality, when you guys get into private practice, you guys will see lines that look way more like this. Where you go to pick up your air water syringe and your suction will fall on the floor. So these lines get tangled up in our operatories and they get tangled up in our heads too. So today we are only talking about our water lines, meaning the lines that squirt water into our patient's mouth. That could be an air water syringe, that could be a hand piece, that could be a power scaler, that could be an air polisher. We're not talking about the suction lines, the lines that pull water from our patient's mouth or fluid from our patient's mouth. That's a whole nother lecture. If you want me to come back another day and talk about suction, we could talk about suction. But to make this fun, we are going to play a game while I lecture, okay? And I call it the safety game. So you guys can say green, you think something's green, good to go, which means 0 to 200. Yellow, time to shock, but still passing, 200 to 500. And then lastly, red, fail. It's a failure, 500 or more. And when I'm giving these numbers, these are colony forming units. That's how we test water. So I tested the water in my pedicure. So feel free to shout out. Who thinks it's green, totally clean water? I don't hear anything. Okay, who thinks yellow? Okay, everybody thinks red?
Yeah.
Yeah? You guys are right. It is totally red. Don't shave your legs before you get a pedicure, okay? Because that's gross, right? Just saying. Now, good news. I did talk to the place where I get my pedicure, and I was like, dude, your water test failed. That's gross. And they started using a liner in the tub, you know? So what do you guys think with a liner in? Do you think it's green?
I'm gonna say yellow.
Okay, yellow. I hear some yellows. It was totally green. So, moral of the story, go to a pedicure place that puts liners in their tub, okay? So why are we even testing this water? Why do we care about dental unit water lines? There is actually biofilm that grows in those lines, much like the biofilm that grows in our patient's teeth or you know, the dog's water bowl. You know what I'm talking about? That slicky kind of feeling that you feel in your dog's water bowl. Or think about a vase of flowers. It's Valentine's Day, by the way. Happy Valentine's Day. If you were to get flowers today and in like 2 weeks, you take the flowers out of the vase and there's that yucky slime layer that's really hard to scrub out, that's biofilm, okay? That same slimy, yucky layer forms in our dental unit water lines. And that can affect our patient's health, that can affect our health, and the CDC, the FDA, the ADL, a lot of people say that we have to be testing our water. So why does the biofilm grow in these little lines? Some of it has to do with the low flow rate. What that means is like when you press your air water syringe, like the water doesn't spurt out like it does when you're in your faucet, right? If you were to fill up a cup of water from your kitchen faucet, it would fill up fast. Where if you were to fill up a cup with your air water syringe, it would take a long time. It has a low flow rate. It doesn't go super fast. It can't clean itself. Also, because these lines are the tubing is so teeny tiny. I mean, it is like some of the lines get so tiny, like you can only fit a paper clip in there. That's how small they are. This picture that you see here with these green lines, the inside of the lines are not yellow. That's actually the biofilm. That's the color of the biofilm inside these lines. And this is what it looks like under a microscope. Like it is alive and it's moving. And these are bugs. Like these are things that are growing. A lot of people often say to me, well, my office is new. It's only like a year old. We don't have to worry about this yet. But there was a study done by Barbeau where they put sterile water into a chair, and it reached 200,000 colony forming units in less than 5 days in a brand new chair. And so 500 colony forming units is what the EPA says is safe. So that's way more than 500. So what is in this biofilm? There's a lot of things. There's bacteria, there's fungi, there's viruses, there's all kinds of things. But there are three microbes that have been linked to harming patients. And that's Pseudomonas aeruginosa, non-tuberculous mycobacterium, and then the Legionella species. So those are the ones that we're kind of concerned about. All right, let's play a little safety game. My oldest daughter, bought a house. And of course I had to test the water in her sink, right? I wanted to know that, did she buy a good house or a bad house? So what do you think? Is Madeline's house green? Good to go.
I say yellow.
You think yellow? Okay. You are right. It is yellow. Look at Madeline's house. There was 5 dots on here, and that was actually surprising. Typically, when you get water out of a faucet, you will get no growth. So my recommendation to Madeline was actually to unscrew the aerator in her kitchen sink and scrub it. Because think about that aerator can collect biofilm, and then that biofilm then goes into the lines. So she did that, and now she is passing. So it was actually, the pipes were fine, the water was fine, it was that aerator. So remember that when you're in an office, if you're using tap water and it starts to fail, it might just be the aerator needs a little scrubby scrub. So I mentioned that this water has harmed patients, and these are a bunch of cases where things have happened. In Rome, Italy, a woman died from Legionnaires. Jonesboro, Georgia had the first major U.S. outbreak where 35 children were harmed. Anaheim, California had a giant one back in 2016 where between 71 and 202 kids were harmed by Mycobacterium abscessus. Then in 2017, a guy died in Sweden from the cup filler. Then we had in 2023 adults. They actually weren't old or young. We actually had middle-aged people that were harmed by contaminated water. And then most recently, actually in Virginia, there was a case where I live, and I only know about this case because I got called in to be a witness for this case. So if you look at this list and you're like, well, Amanda, that's like 6 cases since 2012. Like, that's not a big deal. There are way more cases that we never hear about. And now that I've entered this space, I hear about more and more and more of them. They get settled very quickly. I mean, when a malpractice insurance hears that a dentist office isn't testing their lines, they're like, no, we're settling. We're not taking this to court because we're going to lose and lose bad. So there's lots more cases out there that are happening. We just don't hear about them. But there was actually another case 2 years ago on Halloween, and the CDC actually issued a health advisory network alert for dentistry, which is the first time they've ever issued one for dentistry. Normally it's like, something in medicine, COVID, bird flu, whatever. This was specific to dentistry. And what the CDC said was, listen, dental unit water lines are a major source of contamination, and the public needs to know about this, and we need to be testing. So the public is starting to hear about this. I want to tell you a little bit about the Anaheim case, just because I think sometimes telling a story helps us really remember why this is important. Because when you guys get out into private practice and you're like, oh my gosh, you have 8 million chores, and you're like, oh, you're running and you can't even keep track, and you haven't gone to the bathroom in 7 patients, right? It is easy to be like, is this water really important? So when you're in that state, I want you to think about Mimi Morales. So Mimi Morales is the first kid that was affected in the Anaheim outbreak. That one that I said between 71 and 202 kids. I'll explain that in a second. So Mimi Morales goes into her dentist office in Anaheim, California, and she gets a routine pulpotomy. A pulpotomy is like a baby root canal. Okay, so she had a big cavity and they did a baby root canal on a baby tooth. So the next day, Mimi starts to develop this infection. Her jaw starts to swell. And so her parents take her back to the dentist and the dentist prescribes some antibiotics. Well, the next day, Mimi's face continues to swell. It's not getting better. And so her parents take her to the pediatrician. The pediatrician prescribes a different antibiotic. 24 hours later, Mimi's face is blowing up and a fistula, huge fistula is starting to form, okay? So Mimi's parents take her to the ER, right? I mean, this is all what we would do, right? So she goes into the ER, the infectious disease doctor gets called in and they're like, whoa, this is serious. And they do a major surgery on Mimi. They have to remove part of Mimi's jaw.
Oh, man.
She loses permanent teeth and she stays in the hospital for more than a month on heavy doses of antibiotics. Okay, so this is just from water. This is just water. So this is the timeline for Anaheim. So first, Mimi is the first child that gets infected. So she's 7 years old. She develops this serious infection. She stays in the hospital on antibiotics for more than a month. You know, if you're in the hospital for more than a month, I mean, they try to kick you out fast, right? So this was serious. Well, the fascinating thing is by, the grace of God or the universe or, whatever you think, right? Mimi was the first kid that came in. When the second kid came in with this similar infection, the same infectious disease doctor happened to be on duty. And this infectious disease doctor was like, whoa, this is a lot like that other case I saw 2 weeks ago. Weird. And then the same infectious disease doctor was on duty when the third kid came in. And this infectious disease doctor, God bless her, was like, whoa, hang on. 1, 2, 3. What's the commonality here? And she is the one that figured out that all of these kids had gone to the same dentist. So they call in public health, more children are exposed, and public health comes in and they figure out, whoa, this water is insanely contaminated. And they actually track every single person that stepped foot into that office for years, for like 5 years afterwards. And so, of course, the news gets involved because, we love to make people more afraid of the dentist, and lawsuits are filed. And in fact, the lawsuits are still ongoing. There's 3 families that are refusing to settle. So this will be interesting to see how this works. COVID kind of held things up a smidge. But here are some numbers from the Anaheim case. So public health stopped counting at 71 kids, okay? There are 202 lawsuits, though. That's why I say somewhere between 71 and 202. 71 kids were confirmed to have been infected by Mycobacterium abscessus. So out of those 71 kids, 26 of them had more than one surgery. 45 of them lost between 1 and 6 permanent teeth. And 29 of them had to get this antibiotic that they use to treat leprosy, which, leprosy, that's crazy town, right? But what the side effect of this antibiotic is hearing loss. So 29 of them now have hearing loss. So not only are they facially disfigured, they've lost permanent teeth, but they have hearing loss. So I said it was 71 kids in the public health study. They were between the ages of 2 and 11. 99% of them required surgical debridement. So we're not just talking, hey, here's some pink amoxicillin, like just take that for 5 days, you'll be good to go, right? Serious stuff. But this is the number that I want you guys to take into your offices, okay? So you're gonna go in, you graduate from this dental assisting program, you're gonna go into offices and you're gonna be like, hey, are we testing our water? And I promise you, one of you out of the 10 at least is gonna hear, we don't really have to do that. That's not really that important. I've been treating patients for 30 years and I've never killed anybody. This is the number I want you to remember. The symptoms showed up in these kids, these 71 kids, between 1 day after treatment, that was Mimi, and the last kid, his infection showed up 409 days after his pulpotomy. That Mycobacterium abscessus sat in his lungs for 409 days before whatever happened in his immune system decided, okay, now I'm going to come out. So what this number says to me is, I said I didn't know anything about water for 25 years, right? I had never tested water, maybe flushed it. That was it. What this says to me is I'd like to say, well, I've never killed anybody. You know what? I don't know that I haven't harmed anybody. It's kind of like that, when you get a sick stomach, you're like, oh, was it the Thai food or was it the card at Target? Or I don't know what caused my illness, right? So the idea is that we just don't know. And they would have never found the kid on 409 if it hadn't have been such a huge outbreak. It would have just been a weird infection, right? Where this kid would have then needed treatment. So remember that number and be like, listen, no, we still have to do this because we don't know. Now, if you're wondering like infection, you're like, Amanda, I don't know what that looks like. These are pictures of the people that were harmed in the Venezuela outbreak. And so this kind of just shows you what I'm talking about. Again, pretty serious, right? And look at this. If you see down here near E, I don't know if you guys can see it, but it is eating away at the bone of their jaw. So these are really serious infections. Now, what is the one thing that all of the US cases have in common? None of them were testing their water. This is where you guys come in. Testing your water is the only way to know and ensure that the water is safe. And our patients are listening to this, right? I mean, you know, they want to know that things are safe. I say when you test your water, you guys should post it on your office's social media and be like, hey, we're testing water. We're keeping you safe. All right, let's do safety game again. Do you guys ever hear that you shouldn't get ice on an airplane? So I tested the ice on my Delta flight. What do you guys think? Do you think it's green?
No.
No.
No? So you think yellow?
No.
No? So red.
Yes.
Okay, good news. Green. Delta, green. You can get ice on your Delta flight. Okay? You are safe. And I've tested it numerous times. All right. So I talked about patients' health. And I think as caregivers, as dental assistants, you know, we get into this because we love people, right? We want to take care of people. But this actually also affects your health, my friends. So, you know, when COVID happened, I think we became all of a sudden aware of aerosols. I never thought about aerosols prior to COVID. And now I'm like, oh my gosh, I'm like coming through like a sea of dandelion wishes, like trying to get to my operatory. But I have really good news when it comes to aerosols. The Ohio State University and then the University of Alberta both did this same study and got the same result. And what we know is that 78% of the aerosols that we create in an operatory, they captured the aerosols and they figured out what was in them, right? 78% of the aerosols that we're making when we spray our air water syringe or use our hand pieces, this is what you're breathing, 78% of it is coming directly from our procedural water. So if your water is safe, if you're treating and testing your lines, you know what you're breathing all day long is safe. In the Ohio State study, they found that 0%, came from aerosolized saliva. We're not aerosolizing patients' saliva like we thought we were. We're actually just aerosolizing our procedural water. So what are you breathing? Is yours safe? There was a 1988 study that showed that dental professionals have a higher risk for Legionella. And we know that the exposure to these endotoxins that can come from our water can exacerbate asthma and other respiratory conditions. And they redid the Legionella study because somebody tried to debunk it. And no, they found definitely we are at risk for Legionella as dental professionals if you're not testing your water. If your water is safe, you are safe. So this is about you and your health. So if it's not enough to care about your patients and yourself, a whole alphabet of organizations say that we have to do this. So you got to do this, right? There's just no way around it. So what does the CDC have to say? So the CDC says that the water that you squirt into patient's mouth from your handpiece, from your drill, from your power scaler must be less than 500 colony forming units. And then it kind of drops the ball, truthfully. Then it says, well, ask your manufacturer of your chair how to deal with it and, you know, follow whatever recommendations they have. All right, safety game again. Ice on a Southwest flight. What do you guys think? Delta was green. What do you guys think about Southwest?
Well, Southwest is a cheap flight.
So what do you think?
Yellow.
Yellow? You are right. It was yellow. Don't get ice on Southwest. Okay? This is what I've learned. Okay, so how do we take care of our water? You're like, all right, I want safe water. I want to be in an office that has safe water. What do I do? We're going to do a system of shock, test, treat, and then maintain. The first thing you have to figure out when you walk into an office, where is their water coming from? How does the water get to the chair? So is it coming in straight from the city and just from the chair? Are you filling water bottles in your chair? Or is it going through a centralized system and then to your chair? So they have these centralized systems. If there is a centralized system, I want to encourage you to make sure that system has an antimicrobial agent in it. Sometimes they just pull out total dissolved solids. Like if you live in an area that has a high mineral content, they just pull that out, but they don't actually treat the water. So make sure you ask questions if it's a centralized system. If it's coming in straight from the city, then they need to do something. They either need to put in a centralized system or they need to retrofit their chair with independent bottles. There is no choices. You cannot get by with simply city water because there's no way to treat it. I prefer bottles. So does the ADA, so does the CDC, so does the Association for Dental Safety. They're a little bit easier to control. And you can continue to work if you have a boil water advisory, which we've had quite a few in Virginia lately, which is crazy town, like that have lasted weeks, where if an office didn't have a bottle system, they had to shut down because that water wasn't safe to squirt in patients' mouths. It is a pain in the tuchus, though, I will tell you, to run out of water halfway through a procedure. That would be the downside to a bottle. But I think the other things outweigh it far more because it's cheaper. You can fill the bottle with the water that you want to. You can work during a boil water advisory. You can use different treatment products, and you have way more control over your program. So what are you going to fill your water bottle with? Let's say you do have a water bottle, and what are you going to fill it with? So you could fill it with tap water. I mentioned tap water is just fine. If your tap water is good, that's easy and cheap, right? You could use distilled water. I want to encourage you, though, if your office is using distilled water in the chair, check the chair's instructions for use to see if you're allowed to use distilled water. But ADEC says no distilled water, and Midmark is about to change their instructions for use to say no distilled water. That reason is because distilled water is actually leaching from the metals, the brass fittings, and it's actually it's harming the chair. So now 2 companies are now saying no distilled water. You could go buy spring water from, Sam's if you wanted to and fill your water bottle with that if your tap water wasn't very good. Shannon Mills, who wrote the white paper, like the genius of dental unit water lines, he recommends using a tea kettle. So you boil the water. So you're actually like almost sort of sterilizing it and then filling the bottle. That's a lot of steps. He's never worked clinically, so he doesn't know. Or you could even buy sterile water if you wanted to and fill it with sterile water. Very important, though, putting sterile water in your bottle, it's not sterile coming out because the microbes are happening in your chair, in the line. So don't think it's sterile water coming out. Okay, so the first thing we're going to do is shock our lines. Shocking is using a strong disinfectant to blast the biofilm out of those lines. If you enter an office that has never done anything with water lines, I guarantee you need to shock the lines. You want to shock kind of at the beginning of the waterline journey. You're going to shock if you change products. If you go from one product to another product, you want to shock because every product leaves behind a residue and you don't want patients being like, that tastes funny because it'll put the residue in the patient's mouth. And then you want a system in your office of shocking periodically. In my office, we shock quarterly. And unless we start to get some growth on our paddles. And if we even get a couple dots on our paddles, we go ahead and shock. So don't wait until you fail to shock. That's like waiting until a cavity's really big until you treat a cavity, right? Like, let's take care of it when the biofilm is starting to grow. In that yellow, when you see yellow, those couple of dots, go ahead and shock. Let's blast that biofilm out of there before it has time to make a ton of biofilm babies. So these are some different shock products that are on the market. Some of them are stronger than others. Liquid Ultra and ICX Renew are your two strongest commercial shocks. A lot of people love Citrasil because it's cheap. It is a very, very weak shock. So if you are failing, that will not kill the biofilm that you need it to kill. I am a huge fan of diluted bleach. Some people don't like it. They get a little scared using it in their chair because they're like, I don't know, bleach, it's bad. If you follow the instructions for use on how to do a bleach shock, you're fine, which is only 10 minutes. Only leave it in the line for 10 minutes. Not a day, not a week, 10 minutes. So no matter what product you pick, you must follow the instructions for use that come with the product. Don't think that you're like, you can change how it works because no, it works like they said for a reason. So how do we shock? You want to turn off the unit and you want to air flush the lines, meaning you want to press the buttons on the air water syringe and just let the air and water kind of come out. That way you know that the shock you're putting into your bottle you know what's coming out is shock, okay? So choose your solution, whatever you're gonna do. Sometimes you have to mix like 2 bottles and into a bottle or whatever. Just do whatever it says. If you're using a treatment straw, which we'll talk about in a second, you might need to change out for a dummy straw, but I will explain that in a minute. Reattach your bottle to the chair and then run that shock into every single line that gets water. Air water syringe, power scaler, handpiece, air polisher, anything that can get water, run the line in, run that shock into it. Make sure it gets all the way through. So I always have a bucket. I put it all into a bucket, okay? Leave it in for the recommended time. So Liquid Ultra and ICX Renew are overnight. Bleach is 10 minutes. Again, more is not better. If you say 10 minutes, you're like, okay, so 2 hours is better. No, 2 hours can hurt your chair. 10, 15 minutes tops, 15 minutes tops. If it's an overnight shock, put a sign on the chair that says shock in progress. Just in case, like, you're sick the next day or you forget the next day, because could you imagine if somebody like squirted shock into a patient's mouth? That would not be good, right? So just put a little sign there. Then once you've left it in for the amount of time, either flush it all through or like dump out your water bottle, whichever, and then fill your water bottle with warm water and flush out like 2 to 3 bottles worth of warm water, just so you make sure you get it all out, because you don't want your patient to be like, it really tastes funny, right? Because they'll totally complain. So flush all that out. If you're using bleach, do not put bleach into your suction lines. That will then go to your amalgam separator and it will mess with mercury. And that's like the volcano that you made in 3rd grade. And you don't want to do that. So no bleach in suction lines. This is why I always have a bucket. So this is what it looks like when I go into shock lines at my office. I have a bucket. I got a jug of bleach, just like cheapy bleach. I have my tests. I have a measuring cup because it's a 1 to 9 bleach solution and I can't do math. And so I just do 1 cup of bleach and then I do 9 cups of water and that just makes easy math for me. And then I have the dummy straw. So I mentioned dummy straw and you're like, what are you talking about, lady? Okay. So dummy straw is an uptake straw. So you might find when you get to your office that they are using a treatment straw, which to treat their lines, okay? If you see that they're using one of those, you don't want to shock through it. You don't want to put bleach through that because you could damage it. So you want to take it off and you want to put on just this dummy uptake straw while you're shocking, and then you put your treatment straw back on. They're really expensive, so you don't want to wreck them. All right, so now we get to the testing part. So there is in-office testing and there is mail-in testing. Both are great, but testing is the only way to know that your water's safe. No matter what protocol you pick, no matter what products you use, no matter what shock you use, you have to test your lines. Now, when I talk about tests, they sell some tests at like Home Depot and Lowe's that are for water. They are for drinking water and they do not test for colony forming units. So do not go to Home Depot or Lowe's and buy those tests. Most of them are testing for either total dissolved solids, meaning the minerals that are in your water, or they're testing for total coliform bacteria. And when I saw that, I was like, total coliform bacteria, that sounds good. That's like CFU. No, total coliform bacteria is just poop. It is E. coli. That is all it's testing for. Of course, we do not want poop in our dental unit water lines, but we also don't want Pseudomonas and Legionella and Mycobacterium abscessus. So don't buy your test there. Make sure you're purchasing a proper dental unit water line test. So when to test? You want to test like at the beginning of your water line journey, unless you know that they've never done anything with their water lines, and go ahead and just start it shocking because save money. Don't waste your money because your test is going to fail. But so at the beginning of your water line journey, and then before you make any changes, you want to test to see, kind of how's it going? What's happening in our lines. Then you want to set up a system for routine testing. So check your manufacturer's instructions for use for your chair, because it might tell you, or if it says nothing, you want to test monthly for 2 consecutive months. And then you want to move to quarterly testing at a minimum. So you're going to test minimum every 3 months. That way, you know that, you're in the clear. And then you need to test after you fail, so if you have a fail and then you have to shock your lines, but I don't want you to test, don't shock your lines and then test right away, because you're actually going to get a false pass because all you're testing is the shock. I want you to wait 3 days. So if you fail and you shock, wait 3 days and then test. I have no science behind that though. This is just me talking. So collecting your sample is super easy. Read the instructions for whatever test you choose first, because they have very specific ways to collect your sample. But the first thing you want to do is flush your lines for, like 30 seconds. Flush your lines, and then collect your sample. You can do what's called a pooled sample. So back when I started with Waterlines, we couldn't do pooled samples. Now we can. What that means is you are using one test per operatory, not one test per office, but one test per chair. Okay. So what you do is you would figure out how many lines are in that, and you would take equal amounts. You can kind of see the picture here. Like, so let's say this one had 4 lines. So we took a fourth, a fourth, a fourth, a fourth. If you fail, you're going to shock all the lines anyway. And if you pass, you're good to go, right? The only time I test individual lines is if we're really failing bad. And I'm like, man, who is the problem here? And I will tell you, it's always the power scaler. The power scaler is always the problem. It has long lines, really low flow. So some tips for getting a good sample. First, figure out how many lines you have in your office, in your operatory, right? Or how many operatories you're testing. Decide whether you're doing pooled sample or individual sampling. Wash your hands and put on your gloves, just like you've been taught. Flush your lines for 30 seconds. Now, this is a pro tip, guys. I want you to remember this because I forget it all the time. If you are testing in an operatory that has a handpiece, an air-driven handpiece, get that sample first. Otherwise, if you do it last, it will blow the entire sample out. So this is what a little testing thing looks like. So if you fill it all up with water and then you do the air-driven handpiece, the air will just blow it out. So do that one first, and then do your air water syringe, and then do the other air water syringe or whatever, however you do it. So there is in-office testing. The nice thing about in-office testing is it's totally confidential, so you can fail in private. When I started my Waterline journey, and we were totally failing because nobody had ever done water in my office, I started with in-office testing, and we failed bad. You do get an imprecise colony forming unit count, but it's more economical. So with that quarterly testing, since you're testing that many times a year or monthly, then quarterly, it's a way to make it affordable. And you can get your results in 15 minutes to 7 days, depending on the test that you choose. So these are some different tests that are on the market. There's more and more coming out every day. There should be more coming on the market super soon. I want to caution you about a few of these tests. The 2 tests on the top are color change tests. If you have any issue reading color, and it's like a pink to purple, it's sort of like, am I wearing black pants or navy blue pants? If you have any trouble distinguishing color, do not use these 2 tests because you won't be able to tell. It's really kind of, you gotta be able to see it. There's a new test on the market by Solmetics, which I was super excited about. It's a 15-minute test. You're like, bam, 15 minutes, it's the bomb. Actually, if you read the instructions for use, it says that the results cannot, I forget the exact words, but something to the effect of they can't guarantee the results. And it's really more considered a screening tool. There is an office that I know of it's not in your state, it's in another state, that was using these tests, and they got inspected by the board, and the board said, no, that doesn't qualify as a test. That's only a screening tool. And they got in trouble. So I would not use that. I wouldn't recommend that test at this point. Mail-in tests. Mail-in tests are really nice because it's third-party verification. Somebody else has said you're passing your Waterline test. You get really precise results. But it requires overnight shipping, so it's more expensive. But you do get a report emailed to you, and you get results in 1 to 7 days, depending on which test you choose. There's lots of laboratories out there that will do tests. These all do a heterotrophic plate count, which is an auger plate, and they like pour the water on and they let it grow for 5 to 7 days, and they give you your results. There is a new mail-in test on the market called flow cytometry, and both ProEdge and Agenix have this product, and you actually get your results in 1 day. It uses lasers and fluorescence to be able to read the bacteria. It's pretty cool. In my office, we do a mail-in test once a year. So we have third-party verification. We get precise results. And the other times we do a quarterly test. I always do it in January because I like to mail the water test when it's cold, because I don't want to mail it when it's hot because I'm afraid more biofilm would form and we would fail. Speaking of fail, what do you do if you fail? I'm a big fan of what I call the triple shock. Shock 3 times in a row. So whether that's 3 10-minute bleach cycles in a row or 3 nights in a row with Liquid Ultra or ICX Renew, But what that does is it takes away the protective layer of biofilm, the virulent layer of biofilm, and then the dead layer of biofilm, which new biofilm hides in to make more biofilm babies. If you're failing, train shock products. You might be using, maybe you're using Citrustil, which is a weak shock, and you really need that liquid ultra. Check for dead legs. What a dead leg is a line in your operatory that maybe you guys don't use. Maybe it's a hygiene op, and it could have an air-driven handpiece there, but you guys don't use it. The hygienist is in there. She doesn't use a drill. They don't use a drill. And so it's just sitting stagnant. Like that's where the biofilm, that's like a biofilm rave in there, guys. Like, I mean, man, the biofilm is making babies. And they don't stay in that one line. They jump to the other lines too. Check your source water. Like I mentioned with my daughter Madeline's house, that aerator, maybe that was it. Or maybe you're using a distiller and that actually is filled with biofilm because that has the same tiny tubing. And then lastly, check your filters. On my power scaler, when I started my Waterline journey, I had a filter that looked like this and mine was black. Well, that was the source of the biofilm. And so those filters need to be changed out frequently. All right, safety game. So we've tested Delta, we tested Southwest. How about United? What do you guys think?
I'm gonna say they're yellow.
Yellow? United was a green. You're safe.
Oh.
What I learned is that United and Delta buy their ice. They buy pre-bagged ice. Southwest uses ice makers. And word on the street is that every employee has to bag 2 bags of ice when they check into work on Southwest. So do they require them to do hand hygiene prior to scooping that ice? Maybe that's where the biofilm's coming from. Gross. All right.
Yeah.
So we talked about shocking. We talked about testing. Now I want you to treat. First, I want you to treat yourself because you shocked and tested your lines and you're passing. Woohoo! But we also want to treat our lines. And the reason that we want to do both shocking and treating is I like to make this analogy. So as a hygienist, this is my dad. This is a picture of my dad in for his hygiene visit. So my dad comes in for his hygiene visit. Like I am in my dad's mouth. I'm down in my dad's gums. I'm in the furcations. I am disrupting the biofilm in my dad's mouth, doing everything I can to get my dad as clean as he can be. But I would never say to my dad, hey, Dad, I'm so good at this. You don't have to go home and like brush your teeth or do any home care, right? I would never say that to my dad. Of course, I have my dad brush his teeth. I have him use his interdental brushes. I have him use his floss. I have him use his water pick. I have him wear his perio protect trays. Like I'm giving my dad lots of treatment to do at home. And so you really want both to keep that biofilm at bay. Now, if you are using a centralized system, we talked about this at the very beginning. Again, ensure that that centralized system has a treatment product in it so that it's doing something to fight the biofilm. If you have a centralized system, you cannot shock that system. You have to have a rep come in and help you. So if you have a fail, you must call a rep to come in and help you. However, if we're in bottles, you could be using tablets. Okay, tablets are great. You drop them in. Silver is usually the active ingredient. So figure out the size of your bottle, put it in, let it, and then fill it with water and let it effervesce, meaning like let it dissolve. Because if you just screw it on right away without dissolving, it'll just sit like a rock at the bottom of the bottle. So sometimes I'll even crush them. If I'm in a hurry, I'll crush it and then put it in like powder, and that way it dissolves. I'll do a little shaky shake. I discovered in our office that all of our bottles were different sizes, which was like, woo. So we put little Sharpie lines so we knew where to fill it, so that way we weren't over diluting. Or if you want, you can actually like do the math and like mix the tablet water into like a gallon jug, like maybe an old distilled water jug or a spring water jug. And then you can fill the bottles that way as well. So there's lots of different companies that make tablets. Again, no matter what, follow the instructions for use that come with the tablet. That's how this product has been verified. I talked a little bit about straws when I was talking about shocking, but straws are a great way to also deliver a low-level antimicrobial. There's 2 different active ingredients in different straws. Some are silver and some are iodine. The iodine is not the kind of iodine that people are allergic to or that causes any kind of thyroid cancer. Don't stress about that. It's a different iodine. The big thing about straws is they are not a get-out-of-jail-free card. A lot of people heard, oh, you put the straw on, you don't have to do anything for a year. You still must test your lines quarterly at minimum. Your straw is good for 1 year, depending on the straw, but it could be good for 1 year or 240 liters of water with really good quality clean lines. So What if your lines aren't really clean? What if your source water is bad to begin with? And how the heck do you know when you went through 240 liters of water? I mean, I certainly don't count. So these are the 1-year straws that are on the market. Crosstex, Hu-Friedy, and Stericyl all have them. There are a few that are white labeled as well. ProEdge invented a straw, but they do a 6-month straw. And the reason they did that is they were finding that around the 8-month mark, straws were starting to fail. So they decided, you know what, let's just make a 6-month straw. And then you change it out at 6 months and you guys are good to go. This is where we're talking that dummy straw though. So that's when we're going to put that dummy straw because we don't want to shock through our treatment straw. There are also liquids on the market. Liquids vary greatly in their instructions for use. Some are daily, some are weekly, some are like every day for 2 weeks. And then anyway, read the instructions. So these are some different ones on the market. These are all tend to be a little more gentle. So if you're in a big fail, these are not your friend. You want something stronger. But if they're working for you, awesome. Use them. All right, safety game. Toilet water. This was at a hotel. I checked into the hotel and I went into the bowl of the toilet and tested it. What do you think?
Red. I'm going red.
Red?
Yeah.
All right, the toilet was green. I want you to think about the flow of a toilet or think about the flush, quote unquote, right? It really, that's a lot of water that pushes through. So it's really, and it has bigger tubing. So it's able to kind of clean itself out. I am not recommending you fill your water bottle from the toilet though, friends. Still don't do that. but it's cleaner than our dental unit water lines, which is a little scary. All right. So we talked about shocking, we talked about testing, we talked about treating. Now you want to maintain your lines, right? You're getting yourself into a cycle, you're passing, the lines are clean. I want you to appoint a waterline warrior. I mean, hopefully you take on the job. I am the waterline warrior. I even have a cape. So you can get a cape and run around the office with a cape. It's super fun. People look at you funny, but it's good. Then you want to set up your standard operating procedures. What is the system that you guys are going to do, that entire office agrees to take care of your water? And then lastly, keep records of what you're doing. And I'm sure you guys are learning this in your program, but if you don't write something down, it didn't happen. So it's very important that if you're doing those chairside tests, that you are taking pictures of those chairside tests so that you have the data to prove that your water lines are passing. ProEdge actually has a free dashboard that you can upload pictures of your waterline test. It doesn't matter what brand of test you're using either, which is nice. And that way you can keep all of your waterline testing right there in their free dashboard. I highly recommend you use it. And then if you do mail-in tests with them, those will automatically show up in your dashboard. All right, so at the beginning of the day, I want you to come into your office and I want you to flush every line for 20 to 30 seconds. You will hear some science that says 2 minutes. You'll hear science that says 8 minutes. The CDC has really settled on 20 to 30 seconds. The word is hard to get out though. So I'm saving you time. So 20 to 30 seconds. You know, the lines have sat stagnant overnight. Let's just kind of get things flushing and flowing. Then I also want you to flush between every single patient for 20 to 30 seconds. We do not understand why, but there is some suck back that occurs. So previous bacteria or biofilm or microbes from one patient's mouth actually end up back in the water lines. And so you want to make sure that you flush those between patients so you're not sharing cooties between patients, right? We tend to leave our water in our lines overnight. We do that because we have an active treatment product. We are using tablets in our office. And so I feel like something is kind of fighting the biofilm in the lines while we're at home. So we do not purge our lines at the end of every day. If we close for more than 2 weeks, then we do purge our lines and then shock before we open back up our office back up for patients. So typically we're not purging our lines at the end of the day anymore like we used to. So some myths I often hear is, oh, we use distilled water. We don't have to do any of this. Baloney, you have to do this. It has way less to do with what water you put in your bottle and way more to do with the engineering in your chair because that's where the biofilm forms. And then I talked about this already, but the city water comes straight into our chairs. We don't have to do this. Oh, buddy, you got to come up with a plan. You got to either put in a centralized system, an inline cartridge, or retrofit with bottles. There needs to be a plan. Now, if you are assisting with any kind of surgery, it is crucial that that surgery be done with sterile water with sterile tubing, meaning we don't take sterile water and pour it into our bottle because it's not sterile anymore. You would either put it in a syringe here, and you'd have like a sterile cup where you'd pour that water, like probably a stainless steel little cup, and that would be sterilized, and you'd pull up water that way. Or you could have an entire system that hangs the sterile bag, and it's going through a sterile handpiece. So whatever that is. So those surgical procedures are things like biopsies, periodontal surgeries, apical surgeries, implants. There's a lot of dentists out there doing implants now. You need to be using sterile water. Surgical extractions where they're manipulating the bone, and then endodontics, so root canals, and pulpotomies. And if you remember, it was a pulpotomy in that Anaheim case and the Georgia case where those kids got sick. So it's really important to use sterile water because you cannot introduce those microbes right into that patient's system. So I often hear at the end of this lecture, like, well, do I really have to test? Dude, yes, you for real have to test. The CDC, the Association for Dental Safety, the FDA, the ADH, they all say you have to do it. John Molinari and Nancy Dewhurst found that nearly 1/3 of treated lines still fail to meet the CDC standards of less than 500 colony forming units. So even if you're doing the right thing, even in my office, we still have failed lines. And we only know that because we test. So it's very important that you continue to test no matter what. Non-treated lines that you're doing nothing with, you're not treating, you're not shocking, have 200 to 400 times greater the CDC recommendations. Like it's not safe, guys. 61% of practices have at least one failed line. So it just happens, right? I mean, so there's no shame in failing. There is actually knowledge in failing, and then you can do something about it. And it's the only way to know if your protocol's working. I mean, that is the only way to know. So what do you got to do again? You got to shock. You got to test and document it. You got to write it down. Don't forget. Choose a maintenance product and use it according to the instructions for use. Flush your lines at the beginning of the day. Retest quarterly and document it. And then shock as you need to. Again, my office, we shock quarterly. All right, one last safety game here. Do you guys ever use those water fillers at different places? Maybe you guys have them. That we have them in the airport. I always like to fill my water bottle. What do you think? Do you think that they are safe? You think green? Yellow?
Hope so.
No. Red.
Red?
Red.
Totally green. And I have tested probably 20 of these all across the country. I test them all the time in airports. They all have passed. So you may fill your water bottle safely and not worry about it. And this one was super dirty at the bottom where my water bottle was, but no, it was totally safe. The water was safe. It's a pretty fast flow. Think about how quickly it fills your water bottle. That flow is really able to help keep things clean. So this is a picture of my office's Waterline protocol. And if you guys get out into private practice and you're like, oh, I really want that, go ahead and shoot me an email. I'll give you my email at the end. And I'm more than happy to share this with you just to kind of give you, sometimes it's nice to kind of see what other people are doing. And this is a list of my references. If you want those at some point, I'm more than happy to send you a handout about that. And this is my email address. So if you guys want to write that down, or you want to ask your instructors later on, like, who was that water lady that talked to us? You guys are more than welcome to contact me. I would also encourage you guys to contact ProEdge Dental Water Labs if you have any questions. They will help you no matter what product you're using. And ProEdge will give you a free Waterline test kit. So you can either, you can get it now if you want, but I will tell you when they expire. So don't like get it and hang on to it and then use it past its expiration date because it won't work. Or you can write down this link, or I can send John, I can send you this link. And that way you guys can get a free Waterline test kit. And when you go out into an office, you can test the lines yourself and see if they pass or fail. So any questions about water lines or, in general?
Anybody come up with a question?
I know.
I did, of course. So earlier you talked about the aerosol that's from the water that we're breathing in on how high the percentage was. Was it 70 something?
78%.
78%. So of course we still see offices that are using STM mask as level 1, 2, and 3. So I did a video, actually a YouTube video. It's one of our education videos of also how important that is. Do you agree, of course?
Absolutely. Frankly, I think offices should only have level 3 masks.
I agree.
I think, in theory, you could get a level 1 mask for like a hygiene check, but then you're switching, it gets confusing. You grab the wrong mask and then you're not fully protected. So level 3 all the way, baby.
Yeah, so we'll talk about that if anybody even noticed in our externship or offices what level mask like you're wearing, and it has to do with filtration. That obviously your correct mask on. Obviously, also why we talk about our PPE as well. So I love that we can get those quick those. I want a case of those because I want to text that pet. I want to test that pedicure water as well.
Right? I know, super fun. It's
Yeah,
fun
have
to
a question too.
tested water's fun.
Who's holding officers accountable for this? Like, you test yourself, you come up with a
Is
plan,
anyone
but-
holding an office accountable?
More and more, and I'm really psyched about it. In fact, Georgia, so this is in Pennsylvania, but Georgia on last Friday, it's been 1 week. Georgia, their dental board just passed a law that requires mandatory testing, and they've hired inspectors now that are going into offices and checking their water logs and seeing whether they're testing. And so offices are getting shut down. I mentioned that office that was using the fast check test, their dental board went in. So their dental board, again, this isn't Pennsylvania, but there are offices in Pennsylvania. Typically, the only reason somebody's going to come in and inspect an office is if somebody has lodged a complaint. We don't tend to be very proactive in dentistry, sadly. It's not like restaurants where, I don't know, food service comes in and rates them. I wish, because I want that job, frankly. But it does happen. It does happen, and they are inspecting more and more. It's becoming much more of a thing. And I will tell you, my friends that are compliance specialists, the two things that an inspector asks for first when they walk into an office to inspect an office is your spore testing and your waterline tests. So those are the two things right off the bat that they're asking for now. So yeah, it's becoming more and more of a thing. And I think more and more offices are going to figure out, oh, we have to do this. Darn it. Sadly, dentistry is a little cheap if you guys haven't learned that yet. And so people will try to get away with not doing it. But this one's really important.
So if an inspector walks in and obviously it's that gotcha moment, what kind of repercussions are we looking at for an office that now it's like, hey, we need to see your spore and water, and they're like, water? Question mark.
Yeah. It could be anything from a fine to shutting the office down. It really depends on the state. It depends on the board. It depends on the inspector. It's sort of like if you got pulled over, like, John, if you said, hey, if I was speeding, what would happen? And I'd be like, I don't know. It depends kind of on the cop, right? So it depends on a lot of things, but you can get a serious fine. And I got to tell you guys, there has been a couple of court cases. It doesn't happen often, but where not just the dentist has been held liable for breaches in infection control, but the team has been held liable. So you can't just be like, well, it's just the dentist, right? Because really you're supposed to know better too.
Yeah, it's one of those things in the sense. I've been in an office for 2 years. Mind you, I'm only there 1 or 2 days a week, but I don't ever see anybody test anything.
Yeah.
But I don't know. Who knows?
So, yeah. I need to send you a test so you can go in and test and be like, let me check.
Now, Amanda, when you do these random tests, I'm sure you get looks and what are you doing? Is that necessary?
Let me tell you, my pedicure people said a lot of things that I did not understand, but they had a lot of words.
Yeah.
Yeah. So I do get, and when I'm like letting the water, like when I'm doing it on airplanes, the flight attendants then typically start to follow me on social media because they're like, well, I want to know the results. And so then they follow me so they can see the results later. But it makes for a great conversation. And I clearly talk about this a lot. And I talk to people, whether they're in dentistry or not in dentistry, that, we should, if you're not in dentistry as a patient, you should hold your office accountable. And you should say, hey, are you guys testing your water? Like, I don't want to come in unless you're testing your water.
Yeah, absolutely. We definitely always talk, and I'm sure you agree in the sense of how much the public doesn't realize of what's really happening behind the scenes in the sense of a dental professional. There was just even a social media about, people in the public think that all the dental assistants across the country are an education platform of position, and they're not, as we see. So, when that responsibility of care is there, then this is something that, that as a dental assistant task that we need to be aware of. So we also talked about, going in, if you're there for a period of time and not seeing this water testing, how we can implement it. So we'll definitely help you with that adventure, of course, too.
That's awesome. I love it.
And any other questions?
And what I want you guys to know as, as students in this, like, I think sometimes when we enter an office, like, especially if you're new to dentistry, you might be like, oh, well, I'm new and I don't want to rock the boat. But I got to tell you, I'm willing to bet that you guys are getting the most up-to-date, the best education. You guys are going to be so much more aware of proper infection control. So I would encourage you to say, listen, I learned in school that this is what we should do. And there isn't like school infection control and private practice infection control. There is just infection control.
My question is, where is the aerator on the sink?
Oh, so you will see it if you just go to your sink. Most have it, and it's actually like you can actually just unscrew it, like right where the water comes out. It's like a screen. It's a little screen.
Okay.
Yeah, and so you can just kind of unscrew it. If you don't have one, you don't have one. But sometimes you do.
Okay.
Any other questions?
Any other questions?
I do see a lot of offices not using sterile water for implants, which then they wonder why their failure rate is up.
Scares the crap out of me. Oh.
They're just, not sterile gloves, no sterile water,
Right?
it's a non-sterile field. And I don't know why this patient's on their third implant.
Right? And then we're going to stick it into bone. And I mean, this is off topic, but why did the patient lose the tooth to begin with? And are you putting it into like the grossest oral microbiome of all time and you've done nothing to improve the oral microbiome prior to putting the implant in? But that's a different lecture.
Yeah, yes. Well, this all makes us all more acquisitive and more aware. So thank you, John and Amanda, of course, to give us your time for sure. It's always great.
Absolutely. Happy to come in. And I'll come back anytime.
All right, I'm going to go ahead and stop the recording for now. And then certainly if anybody has any other questions, we can contact Amanda. I'm sure everybody's wheels are turning. So thank you so much, Amanda, for joining us. We greatly appreciate it.
Happy to do it. Thanks for having me. See you later.